And we're staying with health for a little longer. Chief Executive Officer of the Mental Health Authority, Dr. Kwesiose, says the authority has developed a plan aimed at reducing instances of suicide in the country, but it requires funding to be executed. This comes in the wake of recent suspected cases of suicide, about 3 reported only this week. Dr. Osei spoke to Joy News on the sidelines of a stakeholders forum organized by Nyaho Clinic on improving healthcare in Ghana. Joseph Akable was at the forum. He joins me now in the studio so that we can find out what really the forum sought to achieve. Joseph, you're welcome.
Thank you.
Tell us now.
So the forum brought together various practitioners from both private and public institutions, and the idea is that they should come and share their experience as to how they are delivering services at their various facilities as a way of motivating others in order to be able to replicate same in their various facilities. Now, the point Dr. Osei makes is that mental health is very crucial, but he says following the passage of the Mental Health Act, unfortunately an LI has not been passed to enable it to be implemented. So they are saying as it stands, even though the Mental Health Authority exists, they don't have any fund allocated to them. The act was supposed to do that, but they need the LI to be passed by Parliament. So I spoke to him on that.
Okay, so even before you hear him, you recall that yesterday we engaged him on the trend of suicide that we're experiencing in 2017, and you recall that he said the same thing. We can hear him on that now.
We have put in place a package which we are prepared to roll out, but we need the backing, the enabling environment. The government needs to pass the legislative instrument which will give us the funding. Now we don't have the funding. In fact, all our funding is coming from our development partners, DFID. But the government itself has not given us funding, mental health funding. Beyond paying our salaries, we really don't have any funding. So we want to use this medium to say that please, the government must give attention to mental health care. Pass the enabling legislation, LI, provide the funding. Then you'll be able to resolve all these issues.
So he basically makes the same, or goes on with the same lamentations that he had yesterday. Did you find out from him whether or not they've come, how far they've come, how far the authority has come with, in the search for, on the quest for the LI to be passed?
He says they've been engaged in Parliament. In fact, he commended Parliament for, in the first place, passing that act as far back as 2012. But his concern is that beyond that, as it stands, that act, what it was supposed to provide was for a fund, and a certain amount will be sent by the Ministry of Finance as a levy that will be sent into that fund. That will provide money for them to execute their program. But as it stands, because that has not been done, they have to rely on donor agencies and as well as the charity of others in order to undertake that exercise. So that is a major challenge they are facing now.
Okay, but we know that they mentioned something. This forum actually spent some time dealing with the NHIA. What is that?
It has to do with the role it plays, and the NHIA is the biggest service provider. They pay the service providers across the country. Right. So they are saying that if they decide that before you pay someone, that person has to be delivering quality service, that can motivate people to work hard. But you all know that for some time now, the big challenge facing NHIA has to do with funding. And there's one thing that the government wants to get around. But the point that a director of claims makes is that she believes the issue has to be settled by government taking a look at those who they prevent from paying premium when they register onto the scheme. Okay,
so she basically is talking about pulling a lot more people in the premium net. Is that correct?
Exactly. Okay. Because as it stands, says the premium net just is about 5% of the revenue of the NHIA. She says that the rest of the funds comes from VAT as well as the other from SNIT, and this amount has to be given to them. But the premium is the one that they control directly. So we can hear from her on that.
Okay, let's hear let's hear them on the National Health Insurance and whether or not we'll be able to rope in a lot more people to pay premium.
As you know, our money comes from a central source. We have 3 sources of income. The 2.5% levy, which is part of VAT, SNIT, and then the premiums of the members. Okay? The SNIT and the levy don't come to us directly. They go somewhere, and then somebody has to transfer it to us. If it hasn't been transferred, we can't pay. Where the premium is concerned, so many of our members fall in the exempt category. They don't pay premium. So everybody under 18, all the pregnant women, everybody over 70, all the people that the Ministry of Gender and Social Welfare say shouldn't pay, the prisoners. So 70% of our membership pay no premium. Only 30% pay, and that is like 5% of our income. So if the rest has not been transferred to us, we can't pay. It's as simple as yes. We're looking at reviewing to streamline the system. We must make sure that the national scheme pays for what is most important to Ghanaians. What are the real health needs of Ghanaians? Let us make sure we pay for that, especially the health needs of what I call the vulnerable groups, the under fives, the pregnant women, the poor, the indigent. We must really assess what do they need and make sure as a nation we pay for them. Then we look at our income and our costs and decide what else will we pay for. But we can also look at how do we make more money. We have made it that every pregnant woman should have it free. There was a good reason why we did it to start with, to encourage people to go to hospital, antenatal and all that. But we've got to a point where maybe those who can afford it should pay premium and those who can't should be given it free. Every child under 18 currently has a free health insurance. Those of us who are in employment, should our children also have free health insurance? Maybe we should ask them to pay. Maybe the cutoff should be at 5 years. I don't know. I'm just saying there are suggestions.
We should take a look at the incentives again.
We should look at some of the exemptions. It's one of the recommendations we've made. We need to look at the exemptions again. If 70% of the membership pay no premium, and then the levy that is being collected is not enough, something has to give somewhere. You can only spend what you have, and our revenue is less than what we have to pay to the hospitals for claims. So one of the two, either the revenue has to go up or what we spend has to come down. It's like balancing your budget at home.
So that's the Dr. Selby there talking about, well, perhaps what we need to do about the NHIS. Maybe we should review it and get some more money into it. Otherwise, the system fails. A lot of people will perhaps not agree with it. Was that a kind of consensus at the meeting?
Well, it is one thing that it may be difficult for many to accept, but it's the sad reality that we may have to live with, because the fact of the matter is that government, in fact, has mentioned that they want to find a way of creating alternate fund to support it.
That's according to them, right?
That's according to them.
Right.
But again, she says that she thinks, she's of the view that before you even go about that, you have a present challenge. She wants, again, government to review it in terms of the disease that it addresses.
Yeah.
She feels we can identify as a country major diseases that are prevalent and decide that we'll address those ones. Okay. And the other ones that we think is not so troublesome, we can allow people to cater for those ones themselves, else we end up spending so much and it affects the budget.
That's if they can afford. It's a very dynamic topic. Thank you very much, Joseph. Joseph Akable was not in court today. He went following up on health stories. Well, we'll still stay with this matter a little longer because this week has been quite heavy on bloodshed. Between Monday, like I said previously, between Monday and today, 3 persons have died, and although the investigations are still ongoing, as the police has indicated, we know at this point that there are some psychological underpinnings to the causes of those deaths. Now, that is the reason why we think that the conversation on mental health is crucial. Yesterday, we heard the CEO of the Mental Health Authority, Dr. Kwesi, and what he's saying that something that he's been saying for a very long time, a long-term advocacy that he led resulted in the creation of the Mental Health Authority. But again, he has been left lamenting on the lack of funding because the legislative instruments which will make the authority functional is non-existent. We were able to speak to the minority spokesperson on health, Mr. Yele Chure. We don't seem to have him at the moment, but it's interesting, something that we put on our Facebook asking people whether or not suicide has crossed their mind, and it will surprise you to know that people have a lot of issues and it has crossed the minds of so many people. One of them sent me a message and we put that together. You can hear that message now.
I'm always on the edge of committing suicide because I'm always cheated at my workplace and feel rejected. I'm a diploma teacher with my colleagues on the same rank. Each of them earn 1,258 Ghana cedis as their basic salary and 15% retention premium. In all, the gross of 1,448.70 pesos. After every deduction without loan, each of them take home 1,158.29 Ghana cedis. That's because the government pays them. Because I've not been recruited and I'm paid by the institution, my take-home pay is just 426.19 Ghana cedis. I have a wife and 3 children. I've complained about this several times to the management of my institution, but no response. I'm a physically challenged person with both legs cut off, but I'm using prosthesis and I can move about. My wife is also physically challenged. With this, do you expect me to be on the road to beg for money? No, I can't do that. Most beggars on the road are placed in such corners. It's a disgrace to be on the roadside for my children to feel good. How about the family, the community, society, and the general public? How will they treat me? So if I end it, they will not be stigmatized.
So that's a story that someone sent to me. It is his life story, and based on those things, he sometimes feels like giving up. A number of people who I put this message on my Facebook page, and a number of people actually said suicide has crossed their mind. Let's go on our official Joy News page and find out what people are saying. So we asked them whether or not it has crossed your mind, looking at the trend of this. And Kofi Sam Klinsman says, anytime a friend starts and as answers to questions, then it's obvious the suicide is near. Sometimes I foresee, especially when a guy breaks a neighbor's heart. Kwesi Boateng Ayepa says, I begin to read meaning into the appearance and mood of loved ones or people closer to me the moment they are moody. Most people around me are the extrovert type, and I have every right reason to question them when and find out why they are quiet and moody. At least that alone is enough for me to put eagle's eye on them. When you're sitting with someone, says Bambaka Summit, sitting with someone he likes doing every minute, you need to watch. This means there is something eating them up. Well, once you're close to the person and all of a sudden they talk about death, every small chat, Fide began to talk about death. Okay, I don't really get that, but I get the point you're trying to make. James says the signs of suicide are as follows, and you go on and on to tell us about the signs of suicide. Let's see if we can read a bit of that. The person will all of a sudden change his or her mood. Can we see more on that? Let's see what is there. Okay, so his or her mood changes, talks about death, saying something like, I will soon travel but don't know when she will be coming. When I'm not there, who will take care of my children? Start sharing his or her properties. The person thinks all hope is lost, etc. Richard Kweku from Paul Master said, I would recognize a sudden change in behavior and try to inquire. I hate to see people die being moody. Okay, so you're basically talking about how you can gauge someone's potential to commit suicide by their mood, the status of their mood and how it changes or swings. Salifu says, when you see the person passing last-minute comments, that seems to suggest he's traveling accompanied by an unusual attitude. Be his or her bodyguard, because he might be a suicide candidate. That's what basically all of you are talking about. But I can go on and talk about a few of comments that I got on my personal page, and a number of them told me that they have actually it has actually crossed their mind. And Isaac Amoya is one of them, and that's not what you're saying, but he says, it has crossed my mind before, but I considered the pain my family and friends will go through, especially Samuel Mensah. I stay with him. He says, the reason is I felt like a failure and some kind of useless dude, not making it in life. This was somewhere in 2012, 2013. Then the thought of the potential I carry came to mind. I encouraged myself and moved on. That's what he says. James Senanu said more times, because the question was, has it crossed your mind, suicide? He says more times, but thanks to God for his mercies and faithfulness. Selom Ezekiel also says, yes, several times, but I think it's a selfish and cowardly way to go. Also, I have the best friends. He mentions Ronald Wesley and Himon Gwenga, and he says that he can depend on these people to get him through the slump. He says prayer books also helps. Maxwell Asari Bediako says depressions and lost hope could be. He's talking about his own experiences as well. Al-Hassan Sumani says, well, Ekwa Adanakwa says, yes, it has. So yes, it has crossed her mind. So if you look at these comments, it appears that a lot more people have considered it, which is why we should keep the conversation going and keep looking out for people who are close to us. If you listen to the message from the person who sent me that long letter, he felt that he's been cheated at work. And that alone makes him feel like he should end it. We'll still keep the conversation on suicide going. And hopefully, as the days progress, we will be able to get to Parliament and get their minds on it, because what the Mental Health Authority wants to do is to roll out a massive national education plan, some kind of anti-suicide policy, but they need Parliament to pass that LI that enables the Mental Health Authority to function efficiently. We'll be getting some more on that perhaps next week. This is The Pulse. My name is Gifty Andopia. Very soon we'll be making way for sports on The Pulse. But let's take a very quick break. When we return, we've got some more. Okay, let's go to the Ashanti region now, where the Center for Settlement Studies of the Kwame Nkrumah University of Science and Technology has designed a new metal window which protects against burglary and provides a safe exit during emergencies. Many people have been trapped to death during fire outbreaks in their homes because they were unable to find exits in their burglar-proof windows. But the latest invention is expected to minimize the impact of such fire outbreaks. Chrissy Deborah reports from the Ashanti region.
Once this house is refurbished, occupants will no more have to fear fires of yesterday, because researchers from the Kwame Nkrumah University of Science and Technology have designed a new burglar-proof with means of escape, and that is bound to make this burglar-proof useless. This burglar-proof design is made from iron rods fitted with a spring-equipped bar which locks up the system by pulling it downwards. A locking device at the base of the spring-equipped bar keeps the system in place. It can be opened by pushing the whole frame up once the locking device at the base of the bar is released. Dr. Divine Ahaji is head of the Center for Settlement Studies, Kwame Nkrumah University of Science and Technology.
Interesting enough, you know, the LI 1630, 1996, has a provision that apart from the opening created by a doorway, in every building, there should be another opening for which, in the case of emergency, we could all escape. So if you look back, it means that technically we have all barricaded ourselves in buildings and we are flouting the law.
The project, which started in 2009, seeks to solve cases of burglar-proof trappings during fire outbreaks. The initial design was equipped with 2 padlocks within the perimeter of the window frame.
Upon consultation with members of the university and a few exhibitions, we have now improved upon this version, because the concern was that when you are in a haste and you can't find your keys, that becomes a very major issue. And some people were also worried that, well, what about if somebody who is a burglar gets to know where the padlock positions are, so that they can perhaps open your window from what? From outside.
The improved version has a holding bar hidden beyond the reach of potential burglars. The locking device at the base of the bar does not necessarily have to be padlocks.
We thought deep again, and now to curtail that, we have introduced this bar which goes all the way to your floor level. So it means that if somebody is even outside the window, there's no way the person can have access down to the floor level to open your window. And now we have also reduced the padlock situation, so that once you pull this bar up, then you have this opening up here. You just push your window and then it is opened. And we think that this is a very marked improvement over the previous one and serves as a better option, which we think should be possible for it to be adopted for window construction in housing development in Ghana. And so we think that the private sector, including grader and all those who are into housing.
We'll bring you that full report in our subsequent bulletin. Right now, though, the person who did that story, Kwesi Deborah, is on the telephone line with me. Now we can speak to him live. Hello, Kwesi, can you hear me? Oh, beg your pardon. It's actually Dr. Ahaji who's joining us on the telephone line. Hi, Doc. Thank you very much for your time. You're on the pulse.
Yeah, hello. Hello, I can hear you.
I can hear you clear as well. So you have been able to come up with this idea. Are you looking at the commercial potentials that it has, and how far have you gone with it, if you are?
Yeah, that's a very good question. You know, as a research department, the commercial value, though important, is normally not our main objective.
Okay.
Our main objective is to promote knowledge and also do things for community service.
All right.
Yeah, but then we have a workshop within the center that can undertake the commercial activity. But we are very much interested in looking at private sector coming in so that we can rather offer training for artisans who design this kind of windows so that they can incorporate them into their activities. And so that is the direction that I think as a university, which is supposed to look at the promotion of knowledge, we want to go. And how has it been so far? Have you come anywhere close to that potential that you're looking to explore? In fact, as you recall from the recount, this idea actually came in around 2009. But for some reason, especially as it was the time that these sliding windows were also becoming popular, it was shelved for some time. But now it is clear that even with the sliding windows, people are becoming dissatisfied. So we think that there's a huge opportunity for this. But I think the problem was with the initial design concepts, and that is what we wanted to improve upon. Right. And I think now that we have done that, I think we are ready to take an agenda that will push us into the private sector to get somebody on board. And we are doing that in relation with the University Relations Office to get that done. Okay. Thank you very much, Doc, and we hope that it gets through as well as you want it to. I'm sure that we'll be catching up with you soon once you begin to conduct these training sessions that you talk about, Dr. Haji, the man behind that burglar-proof, that new kind of burglar-proof in the Ashanti region. Well, barely 24 hours after Joy News aired a story about a death trap on the Achimota overhead bridge, the Minister for Roads and Highways, Kwesi Amwakwata, visited the deadly spot this morning. A deep hole on the section of the overhead bridge has penetrated the bitumen and concrete slabs, dangerously exposing the iron rods used in the construction of that bridge. As unsuspecting drivers use that section, bricks fall through the wire mesh holding the iron rods in place. Joy News' Maxwell Agbagba was with the minister once again this morning, and now he reports.
There is heavy traffic on this stretch of road right now. As it stands now, we have the Minister of Roads and Highways, Kwesi Amwakwata, visiting this place to come and ascertain for himself exactly what the situation is on the ground. So remember, barely 24 hours ago, Joy News aired the story about this deadly pothole right here on the Achimota overhead bridge. As it stands right now, the Minister for Roads and Highways is receiving briefing from the Director of Bridges on the extent of damage.
Being proactive is a very serious situation. It's almost getting to about 40 years now. Under normal circumstances, this bridge could go for another 10 years, problem-free. But unfortunately, a very big hole has developed. So I had to rush, from Parliament, and when we saw it, quickly, the director of bridge maintenance unit, put together a team because we do not want to wait, until something disastrous happens. So you can see the quick response and the organization that has been made from the ministry to get this problem arrested. So we are here, we have seen it. The staff and the engineers of the bridge maintenance unit are all here. And you see that we have cordoned off the top of the bridge, okay? Repair works are going to begin immediately, and for safety and for free movement of goods and people and property, we are going to keep some staff and engineers here permanently, even to help in traffic control. Of course, in conjunction with the police, we are drawing the police attention, and as quickly as possible, we are going to get this problem rectified. And we have also observed that it's affecting other areas of the bridge. So we are not only going to work on this, we will take advantage to work on the stretch that has shown signs of deterioration.
Now, we have the director of bridges here with us. Okay, so Mr. Okine, you've gone around. What exactly is the situation with this bridge?
Well, as you have seen, the potholes have started developing on the road. So what we have to do now is to try and address it. It looks like the concrete is now weak. It was, as the minister said, it was constructed in the 75, 77, almost about 40 years ago. So it's now weak, and also because of the weight of vehicles now going over it. When you go to the ends, there's a lot of vibration. If we have to allow traffic on it, then it means we have to limit the weight of the trucks that go on it whilst we are working. But then it will be better for us to close the carriageway entirely. So there will be a diversion to use just one carriageway during the construction. And then after the concrete has cured, we'll open this one to traffic. Yeah. But there's excessive vibration, I can tell you, on the bridge. There's excessive vibration on the bridge. And I think that is also accounts for what is now happening to the bridge. So in trying to address, that is repair it, we will address all those concerns.
It looks like it's not just this open part. There are some other parts where the iron rods are badly exposed.
So that is why we are going to take off the asphalt from the whole surface of the bridge, and then work out on the other parts that are also showing signs of the problem.
But you would agree with me that with this iron rods badly exposed and the contact with moisture, it would definitely weaken these iron rods. Are you going to change the iron rods?
You are an engineer. You are not teaching me engineering. Well, when we get to that bridge, we'll cross it. But then we'll look at it before we recast the concrete.
There's a lot of moisture, under the bridge. You can see the maps and all of that. What about that?
No, that is drainage from the drainage of surface water from the deck. You understand? So if the new concrete is cast, and then the asphalt put, that will be addressed, because then the drainage will be directed towards the drains on the deck.
Maxwell Agbagba engaging both the minister and the head of roads there.